Hi friends, welcome to classes by Lab Doctor. In today's class, let us discuss about the symptoms of hypocalcemia. So we all know that calcium is a very important mineral and it plays a vital role in maintaining lot of body functions. May it be the health of bones and teeth, may it be blood coagulation, may it be the helping in the receiving and sending of the nerve signals, the contraction and relaxation of the muscles, helps in the release of the hormones and other chemicals, acts as a second messenger. It helps to maintain the normal heartbeat. It supports a healthy pregnancy. It reduces the risk of high blood pressure and also prevents and treats osteoporosis. So, such a vital mineral, whenever it is deficient, it can lead to variety of symptoms. So what are the symptoms of low calcium level in the blood or hypocalcemia? The symptoms or the clinical features of hypocalcemia will depend upon how is the onset of hypocalcemia, whether it was an acute hypocalcemia which happens in critically ill patients who are treated with certain drugs like citrates, etc., or it was a transient hypocalcemia. It was due to sepsis or burns or acute renal failure or certain drugs like heparin, protamine, etc., or it was chronic hypocalcemia. So the clinical features depends upon how was the onset of hypocalcemia. So let us start seeing what all symptoms can we get in hypocalcemia. So I've told you that calcium is very important mineral which is required for the contraction and relaxation of the muscles. So whenever there is deficiency of calcium, patient will complain of muscle aches, cramps and spasm. So whenever the patient starts walking, he will have pain in his thighs. There will be tingling and numbness in his arms, feet, legs, as well as perioral around his mouth. He will have some tingling and numbness sensation. These symptoms might come and go, but they do not tend to disappear with activity. So the most extreme cases, when there is a lot of calcium deficient in the body, it will form a lot of severe symptoms like convulsions, arrhythmias and even death. Whatever the cramps what you see in calcium deficiency, they are involuntary contractions. Usually we see it in legs, feet, hands, abdomen, and patients sometimes say that it is extremely painful, or some just have a ache like cramps in their legs. So their cramps can last for few seconds or for several minutes. So it occurs not only during physical activity but also during rest or sleep. So sometimes you might see patients telling that they have this cramps in the legs which they get it during the night. So one of the reason for that could be hypocalcemia also. So there are various other causes for these muscle cramps, but deficiency of calcium is one of the potential factors. And this calcium, it will contract the muscles. It will help in the relaxations also. So whenever there is calcium deficiency, this will disrupt this process which leads to muscle cramps, which is nothing but the calcium whatever is deficient is not able to relax the muscle completely. So because of which there is involuntary contraction and that causes these cramps. So second symptom of calcium deficiency could be tingling and numbness. So I've told you this tingling and numbness can occur in the hands, in the fingers or in the perioral areas, etc. So your patient tells that they have pin and needle sensation in and around the mouth, in the lips, in the extremities, hand, feet, etc. So this tingling or numbness are abnormal sensations which occur because of the nerve integrity being disrupted because of less calcium in the body. Most of the time you will see that this numbness is not serious, but in severe cases this it can lead to other complication like they are unable to feel any sensations of pain, etc. So calcium deficiency is not directly associated with tingling and numbness. However, this severe calcium deficiency can lead to tingling and numbness of the fingers and toes because it helps in the excitability of the nerves. So low calcium will increase the nerve excitability, and because of which you get this tingling and numbness. Extreme fatigue, I've told you, because of this muscle requirement of calcium, and if there is low calcium, patient will have extreme fatigue. They will have insomnia. They cannot get sleep during the night. Sometimes they have lightheadedness, dizziness, brain fog, forgetfulness, confusion, lack of concentration also because of low calcium. So whenever there is decrease in extracellular calcium, the membrane potential on the outside becomes less negative. So less amount of depolarization is required to begin the action potential. So less calcium will increase the excitability. It is inversely related. Whenever there is low calcium, the excitability of the nerves and the muscles are going to increase. That is because of the less amount of depolarization which is required now to initiate an action potential, because the membrane potential on the outside has become less negative. So because of this, we get signs such as Chvostek sign. So what is this Chvostek sign? It is an abnormal twitching which you see, that is which we can initiate when these muscles are activated. The muscles which are innervated by the facial nerve, also called as the cranial nerves. So low calcium will increase the excitability here, and the patient will have abnormal twitching. So you can see here, when we just trigger this, when we just tickle here, you will get abnormal contraction, that is called as the Chvostek sign. Similarly, you will get something called as Trousseau sign. So when you place the blood pressure cuff around the arm of the patient and inflate it to a pressure greater than the systolic blood pressure, and if you hold it for some time, what happens is, whenever there is hypocalcemia, patient will draw his hands in, thumbs in, the wrist inside. This is called as the Trousseau sign. So this Trousseau sign is a medical sign that indicates a carpopedal spasm. So you can see this in the hands, you can even see this in the feet when we try the BP cuff on the leg. So it will be causing involuntary contraction of the muscles in the hand and the wrist. It is a clinical sign of hypocalcemia or low blood calcium in the blood. I've told you calcium is very important in maintaining the heart function. So whenever there is low calcium, it can cause prolonged QT interval, and it will alter the depolarization threshold, which can lead to cardiac arrhythmia. Sometimes it can lead to heart failure also. It can also cause dilated cardiomyopathy, and sometimes, rarely, it can even cause acute coronary syndrome. So in hypocalcemia, you will see the QT interval is prolonged. Calcium is required for the clotting of the blood. So whenever there is deficiency of calcium, patient might develop petechiae, sometimes even purpura, on the dependent regions of the body. Calcium also plays an important role in maintaining the nail and skin health. So whenever there is calcium deficiency or hypocalcemia, patient have dry skin, they have itchiness, eczema, skin inflammation, dry patches, psoriasis also. Patient have very brittle nails, they have coarse hair, they can have alopecia, that is hair will fall out in patches. Calcium is required for the overall bone health. So whenever there is decrease in the calcium, the body skeletal framework will suffer. It will make the bones more brittle and more prone to injury. So there is osteopenia, that is reduction in the mineral density of the bones. It can also lead to osteoporosis, that means the bones, they become more vulnerable for fracture. Okay, and it can also affect the posture also. Remember, it will take years to develop this osteoporosis and other complications of calcium deficiency. This osteoporosis is usually referred as a silent disease, because it will progress slowly without any symptoms until these fractures occur. So this is one of the important role of calcium, to maintain the density, mineral density of the bone. I have told you that calcium is also required for the teeth. So whenever there is deficiency of calcium, patient might suffer from tooth decay, brittle tooth, the gums might be irritated, weakened these root canals. So calcium deficiency in infants can also impair the development of teeth. So these dental problems can also come whenever there is calcium deficiency. Calcium plays a very important role in the brain function. It could be the neurotransmitter activity, or it can be development of new neurons, etc. So whenever there is hypocalcemia, patient can have some changes or symptoms which are related to our brain activity, like patient might be depressed, patient might be anxious, there might be sleep problems, he might have insomnia, there might be cognitive impairment, there might be memory problems, there could be even hallucinations. It is also noted that low calcium level is also associated with the premenstrual syndrome. So people who are being given the calcium supplements after taking around 500 mg of calcium daily for 2 months, it has been seen in few of the studies that the premenstrual symptoms have improved. So the severe PMS also is linked to low calcium levels. Calcium deficiency can also cause skin problems. I've told you that it can cause acne, eczema, dry skin, psoriasis, dermatitis, hives, skin infection, hyperpigmentation, etc. Because calcium is required for the skin cell turnover and regeneration. So whenever the levels of calcium are low, it can affect the skin's ability to maintain its normal function and health. So which leads to all this dryness, itching or rashes. Calcium has long been associated with cataract formation. So this calcium is very important in the lens fiber cell processes, in the cell differentiation, etc. So whenever there is calcium deficiency, it can lead to opacity of this lens and cause cataract. So calcium deficiency occurs when the level of calcium goes below the normal range. The normal range is between 8.5 to 10.5 milligrams per deciliter. So if it is a mild hypocalcemia, patient may not have any symptoms. But as the calcium level goes below 7 milligram per deciliter, etc., patient might develop symptoms. It also depends upon how soon the hypocalcemia has developed, whether it is acute, whether it is a chronic hypocalcemia. But the common symptoms which are associated with calcium deficiency are muscle cramps, muscle aches, muscle pain, tiredness, extreme fatigue can occur because of this calcium deficiency. I've told you the patient might be very tired, though he is taking rest, though he is eating enough. Because there is low calcium in his body, he might be extremely tired, lethargic, not able to concentrate. So that could be because of low calcium. Calcium, I've told you, it is required for your healthy nails, healthy skin, etc. So whenever there is deficiency of calcium, patient will have brittle nails, they have a dry skin, itchy skin, inflamed skin, etc. So this calcium plays an important role in the cell turnover of the skin as well as the nail. It is very important in maintaining the bone functions. So osteoporosis, osteopenia, the easy fractures which occurs because of calcium deficiency, which we see more commonly, that is because of less calcium. So calcium is an important mineral which maintains the density of the bones. So when the bone density goes down, what happens? The bone becomes very weak and they are easily fractured. I've told you that many brain changes can happen because of hypocalcemia, like cognitive issues. They can have problem in, with anxiety. They can have hallucination, depression, etc. So it's important in brain functions also. It is also important in maintaining the health of the teeth. So whenever there is hypocalcemia, we get this decayed tooths or weakened gums, etc. And also the nerve function, and not to forget the heart functions also. So low calcium can also affect your heart, leading to cardiac arrhythmias. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.